Pleasure to welcome you all to the 15th seminar in Phase 4 of our International Interdisciplinary PhD in Progress weekly seminar series organized by the Global South Network. Before we begin, I'd like to thank Dr. Nauman Rayat, lecturer in law at Leicester Law School and founder and chief convener of the Global South Network for running this weekly seminar series. My name is Neil Aria, and I'm chairing the session today. I'm an adjunct professor in the School of Public Health Sciences at the University of Waterloo and in Health Sciences at Wilfrid Laurier University, as well as in the faculties of medicine at McMaster and Western Universities, and a fellow at the Balsillie School for International Affairs. I was the founding director of the Global Health Office at Western and scholar in residence at Wilfrid Laurier University. I'm also a past vice president of International Physicians for the Prevention of Nuclear War, which won the 1985 Nobel Peace Prize, and was president also of the Canadian affiliate Physicians for Global Survival. I've written, lectured, and taught about the topic of today, peace through health, around the world. I'm a founding president of the Pegasus Institute for Peace, Global Health, and Sustainability, and we've talked about some relations with this type of work with that. The discussant for today is Dr. Sebastian Kevany. Dr. Kevany has conducted over 100 field missions in Africa, the Middle East, and the South Pacific, as well as Eastern Europe and Asia, with a focus on monitoring and evaluation, health security, human rights, biosecurity, health sector governance, research, and operational site visits. Dr. Kevany holds a BA and MA from Trinity College Dublin, an MPH from the University of Cape Town, and is an adjunct assistant professor at Trinity College Dublin, an academic affiliate of the Center for AIDS Prevention Studies at the University of California, San Francisco, and specializes in short-term international technical assistance. Currently, his third public book titled Climate Change, Public Health, and Regional Security in the Indo-Pacific is currently in publication. Our peer commentator for today's session is Adyemi. Ade is currently pursuing his doctoral project entitled Navigating the Complex Socio-Political Terrain, UK Diplomatic Relations and Healthcare Policies in West Africa at the Department of Global Health and Social Medicine, King's College, London. Ade has over 15 years of healthcare strategy and policy experience, including the Mayor of London's office, the UK Parliament, and in local and national roles of the NHS. Ade was formerly a director at the Chatham House, the Royal Institute of International Affairs think tank, where he supported the Ministry of Health stakeholders across Africa by strengthening their leadership and policy development capacity. Last but not least is our guest speaker for today, Adityavarman Mehta, a PhD researcher at the School of Politics and International Relations, University of Leeds. Aditya's Aditya's research examines the role of global health diplomacy as an instrument for peace building in post-conflict Northern Uganda. Previously, he's conducted multidisciplinary research in Somalia, India, South Africa, Ghana, and Kenya. Aditya's educational qualifications include a Bachelor's of Arts in Sociology and Religion from Emory University, a Master of Science in Global Health from Duke University, and today he will be presenting his ongoing PhD research titled The Role of Global Health Diplomacy in Achieving Peacebuilding in Post-Conflict Northern Uganda. Aditya, you'll have about 30 to 35 minutes for your presentation, followed by 5 minutes from comments and questions from the discussant and the peer commentator. If time permits, we'll have a 15-minute Q&A session with attendees. The screen is now yours.
Thank you so much, Dr. Arya. It's an honor to be here, and this is an interesting time for me to be presenting my research, as I had communicated in my email to Dr. Riyad as well. It's because I just returned from my fieldwork in Uganda just a few days ago, and I'm on my way back to the UK in a few hours. So this is a very interesting time for me to be presenting my research, and I'm delighted to say that I can also present some early findings from the time that I've spent in Uganda over the last couple of months. So, like Dr. Arya said, my research is on the role of global health diplomacy in achieving peace building in post-conflict Northern Uganda. So as you can see in this map of Uganda, I did my research in the districts of Kitgum. So as you can see in this map of Uganda, my research was primarily conducted in the Kitgum, Gulu, Pader, and Lira districts. And a lot of the conflict in the area was concentrated in northern Uganda, in the northern Uganda region. So this research is based on the LRA war, which took place between 1986 and 2006. Although the cessation of hostilities agreement wasn't signed by both parties, it is generally agreed in the academic community that 2006 largely was the end of the consistent violence that northern Uganda faced in that period of time. This research will use Ilona Kickbush's definition of global health diplomacy, in part because it was Ilona Kickbush is considered to be an expert in the area, and it's important to have a consistent sort of framework that this research would use, and therefore global health diplomacy is an interdisciplinary field that bridges global public health, international relations, multi-sectoral public policy with a goal to achieve global health. So a brief overview on the history of global health diplomacy. It's a framework that has been used to negotiate health interventions during conflict to facilitate political, social, and structural peace building. The WHO had come up with a concept called health as a bridge for peace in the 1980s, and it was adopted formally in 1998, where the idea of health was being used to foster peace based on the principle that health supersedes political, economic, and ethnic division. There were instances of significant success in the 1980s and 90s, particularly with days of tranquility, which were negotiated between warring factions in a variety of different countries, such as the DRC, Afghanistan, Angola, Chechnya, El Salvador, Iraq, Philippines, Sierra Leone, Sudan, and even Uganda, actually. And Dr. Arya has written about the days of tranquility in El Salvador that to a certain degree fostered trust building that ultimately uh, led to peace talks. One of the key instances of global health diplomacy was in 1995 in Sudan, when a 6-month guinea worm ceasefire was announced to allow health workers to deliver essential treatments and vaccines to villages in Sudan. And the Carter Center was central to this effort. There are critics um, of global health diplomacy as well, and many of those who are unconvinced about the effectiveness of health diplomacy in conflict regions um, often argue that global health diplomacy has only ever led to temporary and short-term pauses in conflict. There has never really been a lasting peace as a result of global health diplomacy. And it is also argued that the Guinea worm ceasefire uh, was a temporary lull in the fighting, and armed groups uh, were preparing a resurgence that commenced after the ceasefire ended. So, keeping all these perspectives in mind, I chose to do my research in Uganda because it was a post-conflict zone, and there is some sort of time that has gone by that allows for the academic community to sort of reflect on the various factors that ultimately led to peace, in relative peace in northern Uganda. I say relative peace because in my as I will talk later in my preliminary findings, lots of respondents from various stakeholders that were interviewed have suggested that that the after effects of war continue to linger, and therefore it is only a relative peace at this point in time. So just a brief overview of global health diplomacy in northern Uganda. Um, Uganda is now defined as northern Uganda is now a post-conflict context, and as I had mentioned earlier, that it is generally agreed that that 1986 to 2006 was the period between which the Lord's Resistance Army, led by Joseph Kony, and uh, and the government of Uganda were engaged in a conflict. In this project, I decided to focus my efforts on HIV/AIDS programs, Ebola programs, and psychosocial programs to determine whether whether global health diplomacy was effective in contributing to the cessation of violence and potentially promoting peace building thereafter. And the rationale behind that is that the initial years of the conflict coincided with a dramatic rise in HIV in northern Uganda, and consistently, even as of today, HIV rates in northern Uganda are significantly higher than the national average. With respect to Ebola, there was one of the most significant Ebola outbreaks that Uganda has ever witnessed, which took place in 2001. And that was a period in which the conflict was at its peak, and therefore it is important to understand whether uh, any sort of Ebola interventions, intentionally or unwittingly, had an effect on the conflict. And of course, psychosocial programs in this period of time are also important to analyze because, um, as I will talk about later, virtually every single NGO respondent that I interviewed said that they were implementing psychosocial programs. And to this day, there is a significant mental health crisis in northern Uganda. So, based on some of the secondary literature that I had studied before I embarked on fieldwork, it was stated quite categorically that the psychosocial needs of communities were not adequately addressed. This was, of course, confirmed through a lot of the primary data collection process. And the rationale behind that was that most interventions focused on primarily reintegrating formerly abducted children and returnees into mainstream society. And while psychosocial interventions were directed at former combatants, um, they neglected a society which was already quite traumatized. The question with global health diplomacy is how do we measure global health diplomacy and its effectiveness or the lack of it? So for this project, based on the literature on peace building, I have decided to use social cohesion and agency as key indicators to determine whether or not global health diplomacy worked in stopping the conflict and then promoting peace building. And social cohesion is influenced by levels of socio-economic inclusion, as well as societal relations defined by levels of trust, a sense of belonging, and a willingness to cooperate. And there is significant literature on social cohesion, which includes vertical social cohesion and horizontal social cohesion, relating to how groups interact with each other, as well, and how groups interact with each other and the state. Secondly, agency is an important peace building indicator as well, and it refers to the ability to define one's goals and act upon them. With respect to agency, this is particularly important in the context of gender during this conflict in northern Uganda, and how that fits into the context that we're referring to, which is why an important part of this project is the role of women and peace building in this period of time. So just the literature on the role of women and peace building suggests that in a study conducted in 2014 by Stone, which examined 156 peace processes, when women were included in these processes, the chance of achieving more durable peace rose up to 78%, as opposed to 61% when women were not involved. And women found it challenging to reintegrate into Ugandan society because of their inherently patriarchal structures, which led them to being ostracized by the community. In this period of time, over 20 years, there were high rates of abduction of women and children. Over 10,000 women and girls were abducted, gave birth to 2 or more children while they were in captivity. And of course, there were women's associations and there was gender sensitive peace building that was involved here. And therefore, I'd like to direct your attention to the pictures in this slide. So these pictures are from the National Peace and Memory Center in Kitgum in northern Uganda. And you'll see the names here of Rosalba Oiba and Mama Irene Glassen, both of whom were instrumental in their contributions to fostering peace and negotiating with and facilitating negotiations between the combatants. So with respect to methods, this research relied on in-depth interviews as the method for primary data collection. An initial stakeholder list was created based on the secondary literature, and thereafter snowball sampling was used to interview respondents. In total, 55 respondents have been interviewed, and a few more interviews are actually scheduled, but the respondents are in different countries, so those interviews will take place at a later time. But these respondents belonged to the categories of NGO staff, government officials, health providers, civilians, including community leaders who were directly involved in peace processes, and academic experts. So the responses that were generated during the initial interviews were key to informing the snowballing approach. So, for example, the Acholi Religious Leaders Peace Initiative was constantly mentioned, and uh, that led us to getting contact information of a number of Acholi religious peace leaders who were interviewed for this project. The contribution of St. Mary's Lacho Hospital was also mentioned in the literature and in interviews. So it was important that we interview people at St. Mary's Lacho Hospital, particularly those who were present during the war. There were numerous challenges in conducting this research. Uh, they were administrative, procedural, and obviously from a qualitative point of view as well. So in-country ethical approval was very difficult to obtain. A process which should have taken about 6 weeks ended up taking 6 months, and that certainly delayed my fieldwork. Procedural facets of fieldwork were also quite challenging because in all the districts that interviews took place in, it was imperative for us to seek authorization from the chief administrative officer, district health officer, and resident district commissioner of all the districts before we interviewed respondents. And because northern Uganda has been so heavily researched, even respondents are quite familiar with the various processes that are necessary for researchers to be doing their work in northern Uganda. And so a number of respondents asked to see stamped documents from the individuals mentioned above before they consented to an interview. Another challenge here is obviously that the war took place between 1986 and 2006, and so the population that was even in their 20s at that point in time in the 1980s, they're quite old now, and they've either retired from their jobs or they've switched professions. So it's very difficult to find people who are working in NGOs for over 20 years or over 30 years. So that made the recruitment process fairly challenging. Unfortunately, a number of respondents who are also active in that period during the war have passed away as well. So it was so in order to get the information that would be useful to this project, it really did take recruitment was important, and a lot of time was spent on recruiting the right respondents for this project. Additionally, in the way that we think about peace initiatives or health programs, this war ended about 20 years ago, so expecting a lot of people to remember the specific names of health programs or peace initiatives was a bit of a challenge. And I think sometimes we view peace initiatives in the form of these formalized peace talks, but oftentimes peace initiatives are taking place on a daily basis through the radio or through plays, and this project in many ways it sort of challenged me to think about how do we define peace initiative in this context. And later on, of course, through the course of this presentation, perhaps we will also talk about the conditions that are ultimately necessary for global health diplomacy to take place, and many ways in which we can actually define global health diplomacy in addition to the definition that I had presented earlier. And last but certainly not the least is situating the spiritual element of the war in the context of this research, because the spiritual element is vitally important in Acholi culture. And given that this war took place in Acholi land in northern Uganda. And what I mean by the spiritual element is that it's well known in the literature that Joseph Kony was considered to be a spiritual medium, an individual who communicated with spirits. It is said that he spoke to 4 spirits, and they all had different roles and purposes, and they guided him in different ways. So one of them was called Juma Oris, who controlled peace within the LRA and ensured that there is health within the LRA. There's Silindi Makai, who asked the LRA to move to Sudan, which eventually happened as well. The third spirit is called Who Are You, and controlled the war and apparently gave information to Joseph Kony with respect to what to expect from the opposition, which is the UPDF. And finally, there's a 4th spirit called Diva, who gave information to Joseph Kony in advance about people who are going to be visiting the LRA for negotiations. And what's interesting about this is that a number of respondents who were interviewed for this project have talked about the spiritual element, and it is a challenge with respect to determining the efficacy of a peace initiative or global health diplomacy, because how do we situate this element within the norms of academic research? And it would be great to even hear more about what you all think, Dr. Arya, Dr. Kevany, and all the attendees, because this is something that I've been grappling with over the last while, particularly since this information has been shared widely by a number of respondents, including an individual who was on the legal team of an LRA combatant who was tried at the ICC, called Dominic Ongwen. And he literally said in exact words that testimony after testimony has stated that that Kony was communicating with spirits, and they talked about various changes in his body language and the information that he gave that later turned out to be true. And of course, I say this all as allegedly, but it's certainly something for us to think about, perhaps in the way that we understand conflict. So to begin with the preliminary findings from a health perspective, almost all respondents said that HIV was a significant challenge in the late 80s and early 90s. Did HIV programs contribute to the cessation of violence? Directly, no. There was only one respondent, a cultural leader in the Pade district, who said that his father, who is also a cultural leader, used rising HIV incidents in Pade district to during negotiations to effect a pause in fighting. So it was the only instance in the interviews that we did where respondents said that they had used rising HIV as a potential instrument to effect a pause in fighting. Did HIV programming contribute to peace building? To some degree, it did. ARVs became accessible in the early 2000s as in Uganda, as most respondents claimed, but there were a number of interventions to minimize stigma, such as radio shows or plays or songs. And mind you, it's important to recall at this point that a lot of that people were shifted to IDP camps in this period of time. They're called protect villages, um, and at that point, a number of respondents, particularly health providers and NGO staff, said that it was easier to gather people given that they were in protected villages at that time and communicate um, obviously the dangers of HIV, but also uh, execute interventions that would help reduce the stigma of HIV uh, in this period of time. And the general understanding was that they felt that it did contribute to social cohesion in that period of time. Ebola was an interesting conversation virtually every respondent, because a number of respondents who talked in some detail about the Ebola outbreak named a certain Dr. Matthew Luquia, who is almost a national hero at this point because of the work that he did during the Ebola outbreak. Ultimately, he succumbed to Ebola as well, but a number of respondents that I talked to had interacted extensively with Dr. Luquia, and it's been almost 25 years since that outbreak, and yet um, almost every respondent mentioned Dr. Luquia. And Dr. Luquia was also he was at the St. Mary's Lato Hospital, the picture of which you can see here on the slide. And he was a widely respected doctor, not only in the community but also among the combatants, including the LRA. And he was abducted by the LRA at one point as well, and I think he was released in after 2 weeks in captivity. Many respondents suggested that Ebola sort of unwittingly led to a reduction in the fighting because uh, combatants were afraid of contracting Ebola. And one of the respondents' project was a former wife of Joseph Kony, who said that that when the Ebola outbreak happened, Kony had instructed various units that are stationed in Uganda at that point. He was in Sudan. They had stationed units in Uganda, and it said to them it asked them specifically not to return to Sudan at that point. And this respondent said that not a single person in the LRA at that point had contracted Ebola. And another respondent who was sort of central to the messaging around Ebola at that time said that a number of LRA rebels had attended those sessions because there was genuine fear around that time with respect to Ebola, and there was also quite a lot of stigma, which was important to address, because people who were traveling from the north to southern Uganda were often ostracized because of the fear of what Ebola could do. With respect to psychosocial programs following the conflict, almost all respondents from NGOs said that they implemented psychosocial programs. Almost all respondents said that there is still a current need to address the psychosocial issues that are lingering from the war, with many individuals quite literally using the term mental health crisis in Uganda at this point. And they all suggested that psychosocial programs contributed to social cohesion, and there was this sense of shared trauma that came from being sort of collectively affected by this situation. And one former LRA combatant who happened to be the personal military escort of Joseph Kony, said that psychosocial programs really helped him deal with the stigma of being a returnee. And in the initial days of his return, he talked extensively about being sort of ostracized and being sort of marginalized in his community. And the psychosocial help that he got in that period prevented him from resorting to violence. Having said that, a number of NGOs that were working at that time said that because the conflict ended, they ended up losing a lot of funding that would have typically gone towards psychosocial programming, and that really sort of exacerbated a number of the psychosocial issues that people faced in that time, from losing their homesteads into moving into protected environments, and what many respondents referred to as the moral decay that took place because they felt that Acholi culture was sort of destroyed in this period of time. Or rather, let me rephrase, I don't want to say destroyed, but they did refer to the sort of degradation of Acholi culture. Broadly speaking, respondents talked about the Betty Vigombe peace talks, the Juba peace talks, and it appeared the common thread through a lot of interviews was that many peace initiatives were not given formal names. So that talked about the Irene Gleason Foundation, for example. From the premises of the Irene Gleason show, the Irene Gleason School, there were these radio shows that went around where combatants are also invited to call onto radio and speak to the community, and that in many ways was suggested to be an effective way of trying to facilitate a dialogue. And again, with the main actors in the peace process, as I've mentioned earlier, the Acholi Religious Peace Leaders Initiative was considered to be instrumental in sort of facilitating talks between the government and the LRA. Betty Vigombe, a number of cultural leaders, one respondent specifically referred to them as unsung heroes. NGOs such as Caritas, which is a faith-based NGO, and were also a part of, they were invited to the Juba Peace Talks in 2006, and health providers such as the St. Mary's Lachor Hospital in Gulu and the St. Joseph's Hospital in Kitgum General Hospital. These were often mentioned quite consistently during interviews. And here in the pictures, I've got Betty Vigombe, who was the Minister of Pacification for the North at that time and was instrumental in conducting those peace talks. And here is the National Memory and Peace Documentation Center in Kitgum that I talked about earlier as well. That concludes my presentation.
Well, thank you for that, Aditya. I believe that this is quite thought-provoking, so maybe we'll have Sebastian respond. And okay, so Sebastian and then Ade responding, and you can respond to them, and then we'll open the floor after that.
Thank you, Neil. Thank you, Aditya. Thank you so much. You know, I found your presentation extremely engaging, and my compliments, my respect, you know, on everything you have been through. You know, I think it's underestimated, under-recognized in global health. You know, the efforts that you have to make in the field. I have done a couple of missions to Uganda, so I'm familiar with the operating environment. Also, many missions to South Sudan. And your bureaucratic delays, you know, that takes patience and deserves recognition in itself. So my compliments also on your presentation, on your work. And of course, with my own interests in health diplomacy, it's so nice to see people engaging on that level. I was really fascinated on many levels, but I think at some stage now or in the future, we can talk about that spiritual dimension. So hard to measure, so incongruous in the academic context, and yet so important, so powerful. And I think part of I'm not saying there's a spiritual element to global health diplomacy, but I think it's one of these things that the more it's believed in, the more effective it is. So if you go to people and communities and you say, this is more than just a global health program, like FC Barcelona is more than a club. You can say, this is also a peace building initiative. This is also gender equity. This is also nation building and whatever you want to call it, international relations. People start to think of it in those terms, and that becomes very powerful. And then it grows. It grows on that basis as well, and it evolves on that basis. Whereas I think if you're only using what you might call traditional metrics, HIV infections averted or quality adjusted life years or whatever, such as the Global Fund and other organizations might traditionally use, you're never going to capture those kind of results. And of course, I can talk more, but before I hand it over, I'll just mention in terms of your efforts to quantify. I've done some work on this in the past myself. Diplomacy is so hard to quantify. It's like quantifying, happiness or friendship or international relations. But I made some efforts to do that. And it's more about what the program does or does not do. For example, you get global health programs, reproductive health interventions, male circumcision, plenty of other HIV interventions that that can alienate communities if they're not well framed in the right way. And on the other hand, you can have global health programs that are less cost effective, such as ARVs, that are extremely powerful on these other levels. And there's ways, I think, of measuring that that you have considered and that I have been working on as well. So I hope that's okay for starters. Thank you.
Great. Okay, and then Ade?
Aditya, sorry, thank you so much for that presentation. I'll echo a lot of what Sebastian said. Conscious of time, so I'll get straight to my points. I wonder, global health diplomacy, I wonder if there's space in your research, and sorry if I missed the kind of scope, to explore the infancy of the scholarship on this. I think as a term, I think it's quite nascent. I don't think it's as mature as other fields. So I wonder if that's come into your consideration and how that affects what you're doing in your research. For quantifying global health diplomacy is really challenging, but I think there are proxies and other ways that we can look at it. And even the diplomatic relationships is interesting. And I wondered, with religion, I think of other intersectionalities for some of the former colonial masters coming into Uganda, Britain, for example, the Christian missionaries, that then has an impact that flows into the religious dimensions that you're seeing now. So I wondered if, there was scope or interest for you to draw a link there. Within international relationships, there's inequities. Sometimes there are mutual relationships, but there is often someone with more power than the other. Negotiations, what do people want out of it? The proxies for global health diplomacy could be, but are certainly not limited to, do these two countries, how much in overseas aid, how much do they collaborate, or do they co-author papers, or co-lead sessions at the World Health Assembly? Have they voted in the same way on particular things? So I think there's interesting proxies to use there, but I would love to hear your feedback on that before I come back. So I'll just stop there for now. But really interesting. This has been Yeah, fascinating to hear. Thank you.
Yeah, thank you very much for your feedback. So global health diplomacy being a relatively new discipline, in the nascent stages, that is, I have taken that into account, and it's part of the reason that I said in the early stages of my presentation that you know beyond the definitions that I had listed in this presentation, through the course of fieldwork, I always sort of questioned. There are so many different facets to global health diplomacy. Because, for example, I interviewed someone at Caritas, which is a faith-based organization, and operated extensively during the conflict. And they had a relationship with they facilitated negotiations, and they sort of facilitated the transfer of drugs to the LRA, medical drugs. And you wonder then, does that qualify as global health diplomacy as well? Because at some level it is creating space for trust building and for dialogue that will take place maybe a few years later or a few months later, we don't know. But does that qualify? Because how do you measure trust building? How do you measure building relationships? Because oftentimes there is this us versus them sort of thing, or you pit two sides against the other in conflict, but it's never really as simple as that, is it? So there is space for that, and I am working actively towards that as well. It will reflect in my work.
Yeah, if I could just quickly come back on that, I think that's interesting. I think you'll then have to set the parameters quite tightly, because if you widen the scope to introduce non-governmental organisations as well as governmental organisations, then the list gets quite wide. But I do think it's interesting, because I do think there are some non-governmental organisations that do global health diplomacy than some member nation states. So yeah, absolutely, I would agree on that definition. Sorry, just one other thing that I wanted to share. Sorry, Neil. Norms. So norms set in and what are considered the normal functions of global health diplomacy. And there are other things you may not have access to, but note verbals, memos that are sent between two actors, strengthen a relationship, and that could also be proxies as well. But I'll stop there. Thank you.
Yeah, and if you could also respond to Sebastian too at the same time.
Sure. I was in the process of getting some letters that were exchanged between cultural leaders and combatants. And when I said that they're considered to be sort of unsung heroes, it was a respondent who used that terminology and said that we don't have access. These were not sort of made public. But they contributed in many ways. I interviewed someone who was considered to be a mentor to Joseph Kony, and this person was imprisoned 13 times for being a rebel collaborator, and it is suggested that this person was sort of directly responsible for the people who were then invited to the Juba peace talks. So I think at the moment, with respect to norm setting, there's a lot of reflection taking place on it. And given that I've just sort of completed fieldwork, I'm just processing this data and trying to sort of establish the scope a bit more tightly. And sorry, with respect to Sebastian, I must say that my supervisor, Garrett Brown, holds you in very high regard and has talked about you often, and your experience in global health and global health diplomacy. So thank you for your feedback. And it is, I think, one of the challenges of this research, certainly in the early stages, was measuring the effectiveness of global health diplomacy, because, as you said, that quantifying diplomacy is a significant challenge, and it's part of the reason that I'm grappling so much with like the spiritual element of this project, but also but also that is why a question that has then emerged is what conditions are necessary for global health diplomacy to take place? Because if we understand the conflict that took place and the nuances there, often there are a significant number of instances which suggest that the political will to end the conflict was simply not there. And even the Betty Bigombe talks that took place in 93, 94 were ultimately sort of jeopardized by one party as opposed to the other. And so in that context, so that raises the questions as to what conditions are necessary for global health diplomacy to take place, and that's again something that this thesis will aim to answer.
Yeah, thank you so much. Just before, if I may, before you go to the raised hand in the group, I will just add that, in this day and age, there are, in the context of decolonization of global health and other political dynamics, and there are a lot of question marks around global health, on so many levels in terms of funding and et cetera. And the more that it's possible to demonstrate that it has hidden benefits, such as diplomatic benefits, international alliances, for example, then I think the more likely you are to maintain and even augment funding for global health programs. I'll just add one quick story about the LRA. I was in rural South Sudan, and we came across the Ugandan army, and they were in South Sudan chasing after the LRA. So that was as close as I ever got. But I'm sure you have some interesting stories. That's amazing you got that close to Joseph Kony. So global health is always an adventure. So anyway, thank you, Neil.
Chidanma, over to you then.
Hi, thank you. Nice presentation, Aditya. So my question comes on the aspect of decolonization. My work is on women in peace building in Nigeria, right? So the spiritual aspect comes out strongly for me when I went to the field. So I wanted to know if it is important to the people, does it affect the implementation of the global health diplomacy? And if the spiritual aspect is important to the people, then how do you intend to bring it in or document it or present it in your work? It's talking about its impact and then its importance to the people, and then its impact on how global health diplomacy is being implemented in Uganda. Thank you.
Thank you for your question. So one respondent said to me that in a Choli culture, if a man sees a woman with a torn blouse, that man could potentially be cursed, right? And apparently in the late 80s, there was this instance where multiple women were wearing torn blouses when the LRA appeared, and apparently that really scared off the LRA, the rebels. Now, so is the spiritual element, is it important? Of course, it's important certainly in the way that we understand the context, the culture, and the conflict as well. And it is important to the people. But the other thing is that I think in a lot of the literature, the spiritual element has been sort of perhaps limited to just the LRA. This respondent who was on the legal team of Dominic Ongwen said, he said to me that, it's not that the UPDF were not engaged in similar spiritual activities, but it's just that because Joseph Kony, was considered to be the spiritual medium, a lot of the attention is sort of highlighted on Kony. And I'm sorry, what was the first part of your question?
No, I was just wondering on the if we are talking of decolonization, then I mean, then it comes back to the people, how they believe global health diplomacy should be carried out. And so I was wondering if the spiritual aspect, because coming from Africa and Nigeria, Africans are highly, especially for me, Nigerians are highly religious or spiritual people. And so it's important to the people. And so if that is important, then when doing global health diplomacy, how does that affect the implementation of that in Uganda? That was just it.
Okay. I'll just bring up a couple of things before we end. Thank you, Aditya, for a very interesting presentation. And I'm glad that you started off more with definitions like the social cohesion and agency. And I think that's a good way of thinking about things. I think it would be useful thinking about scale, like the individual and group. And my students in political science class that I taught in Germany were enamored with the concept of small p and large p outcomes in terms of peace. So you may want to think about that, because I think that often we confuse those two things. Also thinking about what post-conflict society really is, and you defined it as being in 2006, but again, it's good to think about when we really are post-conflict, when we're looking at rebuilding. I think that the measurement part was also very interesting, and talking about some of the methodological difficulties. As you said, people's memories almost 2 decades later, trying to figure out names of projects, and maybe a methods paper might be of interest at some point, especially with your the research ethics aspect, although I don't know whether that would be sensitive to develop that. I was impressed with how you've thought about culture, but I think I'd like you to interrogate that a little bit more in terms of attitudes towards homosexuality, gender, communicating with spirits, and the Western view or the mainstream view and the local view, and what is considered credible, supposedly, as so when we're looking at norms which are accepted universally, and when we're looking at what has to be accepted locally. So anyway, a few interesting things. We are right at the end of our time right now, so I think that we'll end here. So it was a very insightful presentation of your doctoral work, and thank you also to Dr. Kevany and Ade for their comments, and hopefully this will also help you as you develop your final work. The Global South Network warmly welcomes PhD students from any discipline and any part of the world to share their projects and receive interdisciplinary feedback. Anyone interested in presenting their work or participating in a session can contact Dr. Nauman Rayat, the founder and convener of the Global South Network, at the email address that he's going to provide in the chat box. Our next speaker next week is Imrana Buba, a doctoral research fellow pursuing a PhD in the Department of Political Science at the University of Oslo. Imrana will present their project titled Collective Action Capacity and Civilian Compliance in Civil War, Evidence from Nigeria. At the same time next week, as I mentioned, 15 to 1600 hours UK time. Take care. Look after yourselves and have a wonderful day. Goodbye.
Bye. Thank you.
Bye.